Hello, I'm Will Riddick.
And I'm Tracy Rock, and we're talking about a hot off the press article on this episode of Coffee Break.
We're looking at the brand new article, Physical Therapist Management of Total Knee Arthroplasty, published as an advanced article in the journal Physical Therapy. This impressive article outlines an up-to-date clinical practice guideline for the management of patients who have undergone total knee replacement.
The authors completed systematic reviews of current scientific and clinical information, as well as referenced current clinical approaches to management of total knee arthroplasty. All of this information allowed the authors to categorize the interventions and rate them based on the strength of recommendation available for each one. Many of the higher rated intervention categories centered on early strengthening and flexibility training. These include preoperative exercise programs, initiation of physical therapy within 24 hours of the surgery, and high-intensity exercise program within 7 days of the surgery.
Other highly rated categories include the use of neuromuscular electrical stimulation and cryotherapy. However, the most highly recommended intervention was motor function training, including balance, walking, and movement symmetry. This was found to have the highest level of evidence to support its use, resulting in significant improvements in a wide variety of outcomes. So be sure to incorporate training to target balance, weight-bearing symmetry, functional motor control, and of course, gait.
The full article goes further into detail of all of these interventions, as well as provides recommendations of many other categories. We highly recommend that you check this out to make sure that you are providing the best evidence-based care. This article is open access, so you can find it for free by clicking the link in the description below. Thanks for joining us, and we'll see you on the next coffee break.
Cheers.
On this episode of Coffee Break.
All right, I'm going to do one more. Don't do that.
Don't do that.
Yeah.